Should you practice optometry in the state of North Carolina? Well, in this video, I'm going to share with you the pros and cons of being an optometrist in the state of North Carolina, as well as my personal experience practicing here for the past 8 years. Hey guys, my name is Dr. Ryan Corte, and this is Ryan Reflects. On this channel, I share with you actionable personal development content, as well as my thoughts on trending topics and common life experiences. If you're new here, hit that subscribe button. Also, throughout any point in the video, make sure you check out the notes and links in the description below. Growing up, I was born and raised in Metro Detroit, Michigan, and I had the opportunity to drive through North Carolina pretty much throughout my childhood to go visit family in South Carolina, and in doing so, we'd always meet that family in various areas of the state. So the big cities like Charlotte and the Raleigh-Durham area, out in the mountains or towards the beach, and I kind of fell in love with it. And after hearing how strong of a state this is for optometrists, I liked it even more. So after residency, I had the opportunity to split my time between two awesome private practices, one on the north side of Charlotte, one on the south side of Charlotte. I learned a ton about patient care, practice management, patient experience, and looked at things I liked and things I didn't like and what I wanted to eventually incorporate into my own practice. And then just a few years ago, about 4 years ago now, I had the opportunity to partner with my current business partner, Dr. Rachel Rubel, and we took over our first sublease practice next to a lens crafters. And that sublease practice has since grown. It's called North Lake Eye, and it's one that I've been very, very happy at. With that being said, I want to share with you some of the pros and cons of practicing optometry in the state of North Carolina, so you can see if it's a good state for you to plant your roots in. In my personal opinion, there are many pros or benefits of practicing in the state of North Carolina. One that kind of jumps out at me is I'm a family man. I have 2 kiddos, and even before I moved here, I knew that I wanted to meet my love of my life, which I did meet here in North Carolina. She's from California. That's a different story, but I wanted to have a family. And North Carolina is a fantastic place to live and raise a family. You have the opportunity to decide if you want to live in a city, in suburbia, or even in the country. You have access to the mountains, you have access to the beach, you have access to a lot of fantastic things. And me personally, I have fell in love with this state. I think that the opportunity here for optometrists has never been greater. And not to mention, people are moving here from all across the country. So I feel like the secret's out. North Carolina is a great place to live and be, in particular, be a practicing optometrist. When it comes to organized optometry in the state of North Carolina, the North Carolina Optometric Society is strong. It has great leadership. And personally, for me as a student, I had the opportunity to go to the Fall Congress and the Spring Congress for free as a student. I could be a member as a student and even a resident. And I really felt like they had kind of welcomed me with open arms. They hear you out. You have the opportunity to really connect on a deeper level, because this state doesn't have a lot of optometrists. And so the ones that are really involved truly care about the state, the profession, and their patients. And so for you, when you come in, you have the opportunity to really make a lot of impact on our state, particularly working with the state society. What you may have noticed about certain states across the country is there's a lot of ODs, and the supply may be even higher than the demand, and the competition is high, and that's just really not the case for the state of North Carolina. Yes, certain areas have more ODs than other, but in the vast majority of cases, we are at a shortage and there is a supply problem. And so you have the opportunity to come in and you can be an associate for a private practice, a sublease practice, a corporate practice, and you can learn as much as you want from those experiences. You have the opportunity to buy in a practice. You have the opportunity to open cold. You have the opportunity to work for ophthalmology, get involved with the VA network here. There is a ton of opportunity in the state. I get emails probably weekly, if not every other week, about new opportunities that are presenting. And I feel like it gives you the opportunity to really feel out what you like, what you don't like, and do so in a great state. North Carolina optometrists have a pretty fantastic scope of practice, and it's something that they're continuing to work on over time. They can prescribe topical and oral medications to treat allergies, infections, and inflammation, diagnose, treat, and manage glaucoma with the use of topical and oral medications, prescribe oral steroids, prescribe Schedule 2, 3, 4, and 5 drugs, order imaging such as X-rays, CT scans, MRIs, echocardiograms, and more, and deliver injectable treatments for the diagnosis, treatment, and management of eye diseases and agnexa. This is including the treatment of chalasia, periocular injections, foreign body removals, and punctal plugs, as well as perform fluorescein angiography injections. while I personally feel like the list of pros goes on and on, there are some cons. And the first one that kind of jumps to mind is the North Carolina Optometry boards. Well, they have a reputation of being very challenging. And honestly, they're not the easiest board to prepare for, but when you prepare accordingly and appropriately, you'll pass with flying colors. I mean, yes, they are oral. Yes, they used to require you to do clinical skills as part of the examination. But with that being said, honestly, I feel like the new graduate optometrist, residency trained optometrist, or even an optometrist that's been out for a while that adequately prepares can be really successful and pass this exam without any problems. With that being said, I'm going to link to a video above about registering and preparing and putting yourself in a position to best pass this board. So make sure you check out that video. Another downside or con is that the yearly CE requirement to maintain your licensure is 25 hours, and 10 of those hours must be certified by the state. And to be honest, me personally, I love getting continuing education, furthering my knowledge of the treatment and management of ocular disease and improving my patient care skills. But I do have years where I waited a little too long, and then all of a sudden towards the end of the year I need 10 or 12 or 15 hours or whatever it may be. And you can't just pick them up online. You can't just pick them up in the blink of an eye. You have to make sure that you get those 10 certified credits. So it can be a perceived drawback. Yeah, it's a lot, more than most states. But with that being said, very doable. I do recommend trying to plan accordingly by scheduling hours early on in the year so you don't run into that problem. And if you're somebody who is interested in lasers, right? So SLT or YAG lasers, and you're also interested in removing lumps and bumps, North Carolina does not have that scope of practice at this time. There are certain states across the country that do have that scope of practice, while few, I do see more and more states over time expanding scope. And I fully anticipate North Carolina will be following that lead over time. So stay tuned for any scope expansions. But at this point, no lasers, no lumps and bumps. So I'm happy to help you on your optometric journey, particularly if you want to come and practice in the great state of North Carolina. Me personally, I've been very happy here for the last 8 years. I've had the opportunity to meet and partner with and build strong relationships with a lot of fantastic optometrists, as well as, hey, I met my wife here. She's from the West Coast. You see people from the East Coast, from the Northeast, from the Midwest, even from the South. It's a great place to live and be. You have access to the mountains, the beach, growing metropolitan areas. And again, a very strong place to be a practicing optometrist. So if you have any questions, let me know in the comments below, and stay tuned for my next video where we can reflect and grow stronger together.